So I actually wanted to answer the previous question on nationalism, if that's okay. Because I think if you ask the question, is Donald Trump good for global health? The answer is clearly no. Is Brexit good for global health? The answer is clearly no. And I can give you just 3 tangible examples. So first, on universal health coverage, that everyone is covered, has access to health services without impoverishment. We're lucky and we have the NHS. We might have our grumbles about the NHS, it has major problems, but the fundamentals remain there. And generally the public agrees on those fundamentals. We don't have that in the States. And actually now for leaders like Dr. Tedros of the WHO, if he wants to go and promote a UHC agenda, universal health coverage agenda, he does not have the US behind him on that. And that's actually a big blow to global health. Second example, antimicrobial resistance, or AMR. I'm getting into the world of acronyms. I'll try to stay clear of them. So as you know, it's a growing problem, superbugs, people are worried, and the focus has largely been on actual, human consumption. The NHS trying to get doctors to prescribe less. But a large part of the problem is actually coming from the agricultural sector and being used as growth promoters. And this is not happening as much in the EU because it's regulated. It's happening in the US, where it's still not regulated. It's happening in China. It's happening in Brazil, in India. And there you need global agreements. And to get global agreements, you need when Sally Davies wants to champion this, our chief medical officer, that she actually has someone on the line she can call in the States who will have her back. And right now, the US, at least in these global agreements and forums, is pushing back against that. They don't want to have global standards for agricultural use. The third one I'll give is actually an infectious disease. Outbreaks. We're all worried about the next Ebola, the next viral flu that's going to go have a high mortality rate and we won't have a treatment for. And actually, the US plays a huge role. If you look at the Ebola outbreak, how it was contained, the US carries a large share of that burden. Recently, the State Department closed that position. There's no one responsible now at the State Department in the States for global health security. So we can say, the scientists at least I think are aligned on where things are moving positively, but at least from the political viewpoint, and for people around the world, if you do believe, as Liz has said, that all people are equal regardless of your skin color, of your gender, of your sexual orientation, the world you're living in now is extremely scary. And I think it's just worth calling out that our role is actually to speak out against that and continually keep pushing. And Lorna, who's here, has written a brilliant blog where she goes through the tweet about Donald Trump put out a tweet. It's a tweet, but it's a Donald Trump tweet. So it does change markets and policies. And Donald Trump said in his tweet that actually, that pushing breastfeeding is bad because actually you're making women die. And she goes into a very evidence-based blog of actually why he's completely wrong and actually trying to shift actually the public to understanding why breastfeeding is life-saving intervention. And tweets like his are actually extremely detrimental to people's health around the world. So I feel quite strongly on this issue because I wanted to pick it up because we are in dangerous times and those who have a voice should use it today.
Thanks, Devi.